Lie on your back, rest the base of your skull on the rollers, and we're going to start gently but putting a little bit of pressure on the roller. And then as you start releasing that area by just moving your head side to side, you're just going to start exploring a little bit more with it. So you might start doing circular motions and then feel the maybe tension that you might have on these muscles, occipital muscles. Reverse the circle and maybe increase the circumference. Is to put the roller on a little bit of a diagonal, and then I can explore and feel the muscles that are tense as I turn to the right or left, the other side. So just switch that diagonal and turn the nose and chin to the lower side of the roller. And then the next one will be on the upper thoracic spine. Come up to a seated position. So position the roller in such a way that you can roll down and feel that the tip of the shoulder blades are just resting on the roller. To support the head and neck at all times, or we just hover the pelvis off the ground, and we are going to go from the tip of the blades to the base of your neck, and then you go back and forth. So we might feel areas of tension, so make sure that you give them the attention they need, but you might want to choose to rotate your body to the side, so you're just modifying a little bit of the location of the pressure. So you might feel a little bit more flat on the blade. I would not do on the sides of the ribs with the high medium density roller. That can be quite painful. Stay in right in the center. We are going to use the block and something to support your head on your sideline position. Block will be in front of the hip. We're going to shoulders, hips stacked and aligned with the bottom foot. But we are first reaching the hand down the rib cage. We take a breath in. Exhale, we rotate, pulling the ribs with you, assisting with the top hand. Make sure that your pelvis and your knee they don't move, they stay still. And you're gonna repeat until you feel that you are actually increasing in range of motion. That's enough for me. So I'm gonna face the other way, so you can breathe in, exhale. You can allow your head and neck to turn as well. And I feel now that I have an increased range of motion. And that's it for me. You're going to lie on your back, and if you take a breath in to prepare, and you exhale, you press the feet down to lift your hips up, and then down again. So ideally, we are going to start and end the movement in a neutral position, and we are going to aim to have a long line from shoulders, hips, and knee. So as you thrust the hips forward, make sure that you engage the glutes, and then down. And the weight should be all on the feet as you press up. So we are going to start on an all-four position. So hands are going to be aligned with the shoulders, and knees are going to be aligned with the hips. Maintaining a neutral position, we take a breath in, and when you exhale, we're just hovering the knees a couple inches off the ground, pushing the floor away, making sure that you engage your back while holding that position. And then we rest, placing the knees down. We're going to take a breath in, exhale, hover the knees up, hold them up, inhale, and exhale. One more time. And down.